Physicians are demanding that they hold themselves accountable and their colleagues accountable to practicing quality care based on science to keep the public safe. Physicians and registered nurses at the department can accept exemptions based on either the CDC or American Academy of Pediatrics guidelines or other reasons consistent with the standard of care.
You and I have talked about family medical history. I talked about it being an important consideration for me. And you've taken amendments.
Yes.
They're in print. Do your amendments specifically have the words family medical history in the bill?
Yes, that wording is in the bill, correct.
Okay, and I'm looking at it right now. It's on page 10, line 17. It's clearly there. Right. So I just want to clarify that.
Can we talk first about, and I think my colleague from Oakland already addressed the family history and also cited where it is mentioned in the legislation.
I would like to just address family health history. The relevant language of 276 as amended states the department may accept a medical exemption that is based on family history as long as the doctor provides written documentation to support the medical exemption that is consistent with the relevant standard of care. We specifically asked, is family medical history going to be allowed under SB 276? And repeatedly what was told back to us is, it will be relevant standard of care. Relevant standard of care defaults to CDC guidelines and ACIP and AAP, which if you have read them, are all mirror images of each other. So the additional language that you see in that bill basically doesn't get us anywhere other than CDC guidelines. And CDC guidelines do not take into account family health history for the vast majority of vaccines that they cover. A child who is a sibling of a child who died from a certifiably, provably done vaccine reaction by the vaccine courts would no longer qualify for a medical exemption.
I would like to ask the author
Yes.
If the comment made about the latter part of, and I didn't hear that it was an amendment, but I heard that it was a concern. If you could just reply.
Yes. So we apply standard of care, right? So otherwise, if you don't have standard of care, then you're saying that, so if we all have families and we all have family histories, right?
And what, if someone has a family, if family medical history is part of the conversation, can you give me an example of a time when family medical history would allow me a medical exemption that would not require my child to get a vaccination at the onset?
Yep. So, for example, actually in the CDC guidelines themselves, if your child has a first-degree relative who has a congenital hereditary immunodeficiency, you get a medical exemption for the MMR and varicella. So basically,
so just for two.
Yeah. Well, those are the ones where there's the risk because they're live virus vaccines.
What entails the procedure or examination for a medical exemption based on family medical history or genetics testing that you believe will not be considered by the state under the CDC guidelines?
It's incredibly important to understand what those CDC guidelines are. And the senator did answer that the only CDC family history guideline is if a mom or dad or first-degree relative has a severe immune deficiency and that the children might have that. And it only exempts you from MMR or chickenpox vaccine. That's the only family history factor in all the guidelines that are in this bill. There's a small family history factor about seizures. If someone's had seizures, you can't get this one brand of vaccine, but you can get other brands that qualify. So that doesn't work. So there's only one family history factor. Just for example, I'll see a family, the mom had a seizure after vaccines, her first child had a seizure after vaccines. There's no single CDC guideline that would allow me to write that exemption under this new law. Did no family history involved whatsoever that would justify me writing an exemption for that family, because that is not in the CDC or the AAP or the ACIP guidelines. And I appreciate that the Assembly members have asked a lot about family history. You have to realize how narrow that is. This new amendment did not broaden that in any way. I mean, I could list so many severe reactions I've seen moms or dads have, or their first kids have after vaccines, that I will use as legitimate family history to write an exemption for a new baby in that family. That would all go away under this new bill. Those would all be disqualified. And actually, we have a mom here who experienced this exact thing.
My son was compensated by the vaccine injury courts. He was actually diagnosed with serum sickness as a result of his 18-month well baby visit vaccines. One of the issues that I found was that I didn't know that he was experiencing vaccine issues prior to that last reaction that he had that was his most severe, which had him in and out of the hospital for 8 long weeks. He was seen by multiple specialists. He had seizures. He had a condition called thrombocytopenic purpura, where he looked like he had bruising all over his body. So over the course of the whole entire 8 weeks that we were in and out of the hospital and specialist office, all of them actually asked me if we had a history of SIDS in our family, if we had a history of autoimmune conditions in the family, if he had existing autoimmune conditions. And when I asked why it was that they were asking these questions, they said that those were all contraindications of vaccine reactions. They also asked me if he had prior vaccine reactions. I didn't know whether or not he had or not. I dutifully took my child in for every well baby visit and had him vaccinated. What ended up happening was that the immunologist had suggested that we cross-reference his record, get his medical records and cross-reference his vaccine records to all of the times that he was admitted into the emergency room or had unscheduled a doctor's visit. We ended up finding out that he had, within 48 hours, he had symptoms that matched the hepatitis B manufacturer inserts and his 12-month baby visit manufacturer inserts as well. And of course, at 18 months old, the reactions that he was showing, which they did determine were a result of those vaccines, also matched the manufacturer inserts for the symptoms. All of those incidents were viable in terms of the vaccine injury compensation program. And he was awarded through the vaccine court. There was only a few doctors that actually knew what was going on. So when you were speaking to the fact, I forget who was speaking to the fact of the specialists who understand vaccine injury, my child had to go through several vaccine injuries with several different vaccines, because I know that most of us know when we take our child in, it's not usually just one vaccine that you're getting. So one of the issues with my child, and the reason that he ended up receiving a medical exemption, which was prior to SB276, before all of this legislation started happening, was because of the fact that not one medical expert could pinpoint what component of which vaccine he received caused the reaction, because he received so many different vaccines, and most children do at a baby visit. They don't we don't normally get one vaccine at a baby visit. There's usually many vaccines. So with that, he was given a permanent medical exemption due to the fact that no one could tell me what component of the vaccines. No one could tell me exactly what it was. So with that, he had to have a vaccine exemption for all vaccines, and the immunologist had said that the next shots could kill him. So at this point, SB277 is forcing me to decide on choosing between my son's education and his life, and I think that that's something that needs to be taken into consideration. And he wouldn't qualify either.
I know you're not going to reassure a lot of the people in the audience today about this, but I want to give you one more chance to talk just the big picture.
Sure.
Where you started and the concerns, the main concerns that I heard people coming into my office was saying the CDC policy is too narrow. It's too narrow. And that there are other examples that we should broaden the scope. So if you would give us one more chance to outline how you think that those will be addressed in the version before us today.
Yes. So again, what this bill does, it says that certainly it refers to, I said, ACIP CDC, which is an evidence-based approach. It also has the American Academy of Pediatrics, which is a non-governmental, it's a professional society, independent evaluation. And then we also say standard of care, which means that if that's something reasonably done by a physician in California or in that community, then that would be sort of valid. And I would say is that, what we want to try to do is we want to keep kids safe in school. So if the school is above the threshold, it's possible that exemption might not be valid or not, but you know what, that school's safe. The kids who have the exemptions, who need the exemptions, they'll be okay, right? There's a high enough level of protection. But if it drops below that, well, we know there's some kids who have legitimate exemptions, and we need to keep them safe, right? And so the kids who have the legitimate exemptions, we need to keep them safe. And so we got to look at, well, who else is having exemptions? If some of them don't have it, well, maybe they shouldn't keep them because that's actually endangering the ones who really need it.